People are cutting their budgets, they go abroad on business, they've got an extremely tight schedule. Nowadays they're going to some extremely exotic places, particularly in things like the oil and gas industry. They need to be safe. Health and Safety at Work Act actually says that employers have a responsibility when sending people overseas to comply as much as they can, as they would do in the UK. The biggest concern really is Southeast Asia and the sub-Saharan Africa. I mean, nothing has changed in Africa since, who was it, Mr. Stanley said, Dr. Livingstone I presume, nothing has changed. Those diseases are all still there. We've got a few vaccinations, we can treat things better, we have anti-malarials, but the diseases are still present. Well, first of all, I'm here. I can see your employee at short notice. I have all the vaccines and anti-malarials in stock in the premises, so there's no waiting. They can come and see me. I will do a full risk assessment on them. That includes their past medical history, any medications that they're taking. We would look to vaccinate them against the risks that they face, give them the correct anti-malarials, should they require any. Also look at the diseases that we can't vaccinate the traveller against, but which are a danger. And generally give very good advice about food and water hygiene. Businessmen haven't got time to be stuck in the loo for 3 days. They really need to be getting on. And also we stock any bits of equipment that they might need, like insect repellents, needle kits, things like that. So we aim to give a complete service to the corporate traveller. And insurance companies, of course, are also looking at very much, they're now tending towards, if somebody picks up a tropical disease which they could have been vaccinated against and they weren't, they may look to the employer and say they should have made sure the employee was covered. You can't just send your employee off with their tetanus up to date and hope that they will be fine. You do have much more responsibility. But also, you know, we need to look at the normal travellers, non-business travellers. I had a family in the other week with 2 small children, one only just a toddler, and they were off to Costa Rica for 3 weeks. That is actually quite an unsafe area in some ways. So all these things look fantastic in the brochure. The travel agent should take a bit of responsibility and remind you that you may need to seek some medical advice, but you, the traveller, are also responsible for your own health.